everybody. Welcome to Journal Chest's webinar Journal Club for June of 2022. We'll be today talking about perceptions of life support and advanced care planning during the COVID-19 pandemic. It's a very exciting paper, and on behalf of the journal, I am excited here to have our authors Vishal Patel and Dr. Gregory Wallingford with us today. My name is Viren. I am a pulmonary and critical care physician, and one of my areas of interest has been sort of evaluating online conversations and socials, as we call them. So I'm very excited to speak with both Vishal and Gregory. Personally, I have no conflicts of interest with regards to this Journal Club webinar today. So Vishal, do you want to introduce yourself and tell us a little bit about yourself?
Yeah, so I'm Vishal. I'm a student at Dell Medical School right now in Austin, Texas. I went to UT for undergrad, and I actually did a little bit of, in addition to biology, I did some philosophy. That's really where a lot of my interests in medical ethics comes from, and a little bit about where all of this research question actually stems from. So, and I have no conflicts of interest.
Dr. Wallingford.
Hey everyone, my name is Greg Wallingford. I am an emergency medicine turned palliative care physician. So I actually was in the pandemic as both emergency med and as palliative care. So I got both ends of the stick. And I'm an assistant professor and palliative care physician at Dell Medical School. I also have an interest in leadership and some of the stuff we're doing here around how to use big data to make big insights.
Well, both of you, welcome. And Dr. Wallingford, thank you for your service during the pandemic. I think we probably don't acknowledge it enough, and we should. All right, so let's delve into it. So the study, like I said, is dealing with perceptions in the online space regarding life support and advanced care planning. So why don't I just get you started by asking, how did you guys and where did you guys extract this data from, and how did you review it for the purposes of your study?
Yeah, so just a little bit of background on how we actually came up with this research question we really just, my personal experience with this is I was just seeing so many stories on news sources, on social media, just everywhere about mechanical ventilation and ECMO and all these new terms that I'd never seen before on that platform. And it got me thinking, I wonder how much people are actually talking about this. Wanted to quantify it. So that's really where the research question of, how did conversations about advanced care planning and life support change during the pandemic? That's where it sort of came from. The second half of this is while I saw a lot of conversation about life support, I didn't really see that much about advanced care planning or advanced directives in general. And my sort of philosophical background, sort of my ethics background sort of ate at me and was like, I wonder if people are talking about this just as much, because it is just as important. And that those two sort of met, and that's where the research question came from. And so based on that research question, then we chose specific keywords with which we could search Twitter. So Twitter has an application programming interface, which you may be familiar with, Dr. Kaul, Twitter's API. And so what you can do is you can search for historic tweets, right? There's no real time limit for how far you can go back. And for researchers, there's not really big a limit for how many tweets you can pull. So we chose keywords related to a research question like mechanical ventilation, ECMO, advanced care planning, DNR, DNI, and then variations of those words, right? Like do not resuscitate spelled out, do not intubate spelled out, and all possible dictionary variations. And we searched for those words. And so all tweets containing those search terms were collected. And in total, it was something like 250,000 tweets that we collected by 100,000 unique users. And that's sort of the data extraction process.
Fair enough. So two sides of the coin. There's life-saving interventions, or what we can at least garner out of historical conversations online, and advanced care planning, sort of like I said, two sides of the coin. So just for audience purposes, you guys define life-saving or search for life-saving interventions when you were looking for, say, ventilators or dialysis or ECMO, whereas advanced care planning as a separate kind of category was DNR, DNI, end-of-life care, those kind of search terminologies. Okay, great. So on one side is LSI, life-saving interventions, the other side is advanced care planning. So how did the conversations in the course of the pandemic, and also could you clarify what that course time period of search was, how did they evolve for both those topics?
So it's, and actually maybe even before moving on, if Dr. Wallingford, if you want to just talk about the difference between those conceptually, between advanced care planning and life-sustaining interventions, just because it sort of sets the stage, I think.
Yeah, absolutely. So I think me being an ER doctor and not as trained in this was new information to me in palliative care and probably to many listeners in Palm Crit, that advanced care planning is really a process. So eliciting values and then over time matching those values to what medically you're being offered to make sure that your values are being met by the medical treatments you're getting. So advanced care planning can be as simple as talking about things you love. It can be as discreet, though, as saying, I don't want CPR in this particular case. And so advanced care planning is broad, covers a lot of things. And then life-sustaining interventions are very discreet, CPR, dialysis, ventilation. And so I think to go back just a little bit, I know it's veering slightly off course. I think one of the really interesting things is because this is a process, we have to meet people with where they are in that process when we're doing this kind of work. And so understanding where people are has a huge impact on how I start a conversation. And I think part of this whole study is that. What are people talking about? How are they talking about it? Because that's how they're going to walk in the hospital, is what they heard from their friends, what they heard on the news, and then what conversations they've had. So this does give us a little bit of insight into an entry point to start those conversations as productively, I think, as we can. And so, yeah, advanced care planning can cover things like LSIs, but in the ideal world, I think they would be connected, that when you're talking about advanced care planning, life-sustaining interventions are part of that, but not the only part of it. And we often, I think of them as a little bit separate, that if we're talking about dialysis or we're talking about CPR, we must be talking about advanced care planning. So all that to say that I'll hand it over to Vishal to interpret some of this information, but they're different terms that are closely related.
Yeah, so if you look at so the x-axis here is just time. And so we collected tweets about 1 year before and about 1 year after the onset of the pandemic, which is around March 2020 is when it was defined. So so the x-axis defines time, and then I guess it's actually easiest to start with the bottommost panel, which is COVID deaths, global COVID deaths. And so you see that peak essentially in the middle of the graph, and that corresponds to the peaks in the top panel and the middle panel. So the top panel is just those individual search terms, right? Not grouped by LSI or advanced care planning, just the raw terms. And you see that if we start with DNR, DNI in red, actually, all of these tweets, except for the one in gray, CPR, spike and right alongside that COVID peak. And yeah, so I think that is just showing how much more people are talking about these individual search terms after the pandemic when compared to before. There are almost no conversations about things like advanced directives or ECMO before, and so that's sort of what that is showing. And then the middle panel is just showing when you do group these by the two sort of theoretical frameworks that we have, advanced care planning and life-sustaining interventions, that throughout the entire time period, LSIs are talked about more frequently. And then advanced care planning. Even when you consider that spike, there's still almost double the number of conversations about LSIs than there are about advanced care planning.
I think one really remarkable thing is this is not one, but two orders of magnitude that the number of tweets are increasing. So if you just look at yellow mechanical ventilation, it's around 10 tweets a day prior to the pandemic starting. Then you hit March where you can kind of line up on this graph, the big peak, and it's about 1,000. So it's a marked increase in public discussion around mechanical ventilation. And I think, again, like I said, because this is a process and because people take in whatever they've talked about before to when they come into the hospital, this public discourse probably has now 100-fold more increased impact on what people are thinking about as they first start these conversations. And then you can see too that it falls off after that initial March peak, but it's very much a stair step. So it goes from about 10 tweets a day to about 100 tweets per day. So it's still up 10x and sustained there for many, many months, for over a year, really.
Yeah, I was actually, you partially stole my thunder of intelligence, because I was going to ask, so did we ever settle down? And it's a little bit of a prophetic question because, the coverage and the information deluge didn't stop. So you would anticipate that it wouldn't stop. Though surprisingly, the conversations around CPR, around advanced directives looks like did start settling down overall, which I'm sure it's hard to read into, but they did, which was interesting. Okay, so let's talk about, who are these people who are having these conversations, right? So from my own area of research, just acting as the scientific liaison now, changing my gears over from being a moderator, right? So our research group, we studied what we defined as sociomes, the way you've defined your different users. And the idea of the sociomes was, okay, can we understand who are these people who are having these conversations? So tell us about that. Who are the users, and what did you find about the users having these conversations?
Yeah. Oh, go ahead. We're going to say something. Yeah. So in terms of the users, we actually, just to define how we actually identified them, we used key terms, again, to identify these users. So for example, for organizations, if a user had a search, a word like the New York Times or CNN or any sort of organizational name like news network, those counted as organizational search terms. Same for clinicians, right? Something said like urologist in a user's biography, they were put into the clinician category. For influencers, it was a little different because influencers are defined. They're defined differently everywhere, but we chose some of we chose our definition based off of prior literature, where either a verified Twitter account or a Twitter account with over 100,000 followers counted as an influencer.
All right.
So then here in the top panel, you see that a majority of users are just individuals, so they didn't fall into any of the other buckets. And then the smallest group are actually influencers. You can't even really see them in the x-axis. They make up less than, I don't know, 10th or 20th of the population. And most users tweeted more users tweeted about life support than about advanced care planning. Then when you look at the second panel, you see sort of a very stark contrast here. So while influencers have a very small amount of users, they have an order of magnitude more impressions than any of the other users, right? So it looks that inset over there is actually zooming in to the x-axis, where all the other all the other groups are sort of smushed into the x-axis.
Yeah. I mean, I would, if my math is correct, I would say it's probably like at least 10 times more, right? Yeah. So it's order of 1 to 10, right? So interesting. Yeah. And I guess which goes with the territory of, I suppose, being influences. But a few clarifications. Did you ever run into accounts as you were sort of you used, if I'm not correct, a machine learning process to do this, correct? To categorize them?
Yes, not this aspect of it. The category, the machine learning part was for other aspects. We predicted the gender, of the account. We predicted the age group, and then that was also for the content analysis.
So this was done manually?
Well, it wasn't done manually. It was done using search terms. So it was like
search terms. Okay.
Yeah.
So the reason I'm asking is because did you ever run into accounts that you just couldn't categorize?
Yes. And that was actually one of the suggestions we got from a reviewer to validate this process of identifying accounts. And for the most part, if we couldn't identify a user as a clinician or an organization, like if our search terms were not 100% accurate to that, they just fell into the individual category. That was sort of the other other group, right? But we actually did end up identifying specific types of clinicians, right? Like critical care physicians. That was one of the types. We identified specific types of organizations, right? News organization versus et cetera. And that's in the supplementary material, I believe. I don't think it's on this table.
Well, ask and you shall receive. So tell me about your users. Let's talk a little bit about their demographics, because you were saying how you've already looked into their characteristics. So tell us more about your users there.
Yeah. So like you said, we did use some machine learning here to predict these characteristics, and so that's why it's predicted sex, predicted age. And this algorithm, what it does is it looks at it's validated for social media accounts. It was actually the creators of this algorithm made it and used it for Twitter, and they used Twitter data in order to actually make the algorithm. So the way it works is, you have a training set and then a validation set. And so you feed into the protocol, or they fed into this protocol a bunch of accounts where they knew what the gender was, right? They said, okay, this account is for sure male. I know this in real life. And then the actual algorithm looks at the keywords in the profile. It looks at the name, the first name. And then it also looks at the profile picture. And so based off of how it has processed the training set, it will try to predict what the age is. And here results are really that more males, males are more likely to talk about life support, and then younger individuals were more likely to talk about life support. I don't know if Dr. Wallingford, if you want to comment on that.
Yeah, I mean, anecdotally, it kind of makes sense that a younger population is more interested in more aggressive care. And it kind of makes sense, too, that an older population might have a little bit more conversation around advanced care planning because perhaps they or a family member have been part of that. The other thing I thought was interesting is that compared with males, females proportionally talked a little bit more about advanced care planning compared to life-sustaining interventions. And I don't have a great explanation for that. Although one potential explanation is just, I think that toughness is kind of like part of the way that some people define being male. And so perhaps doing more aggressive treatments, et cetera, is more socially acceptable in some groups and therefore tweeted about a little bit more. Not sure if it's true. It's a potential hypothesis.
No, I mean, that's the hard part sometimes, and I'm sure we'll talk about it in limitations, is because you're talking about exhibited behaviors. So, no, fair point. All right. Tell me about, who comprised in terms of these categories that you created of users. What was the distribution so that we have the stage set for going forward?
Yeah, and this actually corresponds directly to the earlier bar graph that we were looking at, the top panel of it, just showing how influencers, or maybe the bottom panel of it, the top panel, that's right. Influencers talk more about advanced care planning, about life support than about advanced care planning.
Yeah.
And actually, we had an interesting, we came across an interesting tweet in our data set, and I don't know if you have that pulled up, Dr. Wallingford, if you wanted to talk about that influencer that we.
Yeah, so this is
right here.
A related segue promise. So there was one influencer, I don't recall the name, but in India, who posted something requesting a ventilator at a time when ventilators were scarce. And he had 9 million followers. So you can imagine how many people or eyeballs saw that tweet. And my understanding is he got his family member the resources needed. And so this goes and is a little bit related to this element of discrimination or health equity that's so important, that people who have Twitter accounts that have tons and tons and tons of followers have access to resources that aren't available to the common person often, especially in a resource scarce type of situation. So just a hypothesis here about why things like discrimination as a theme for the things that people tweeted about may have come up much is that it becomes very clear that resources are not allocated completely equitably in something as simple as Twitter for someone who has 9 million followers, who had all these leads immediately sort of posted, versus someone who doesn't and doesn't know who to reach out to and doesn't have access to that kind of type of group.
Yeah, especially more so during times of stress where there's already a significant information overload, right? All right, so I think this is a segue because we're talking about the impact of conversations, right? And part of the impact is how we feel about those conversations. And traditionally, it's always hard to determine that, but you did conduct what's called a sentiment analysis for these tweets. So walk us through what a sentiment analysis is briefly, and then what were the sentiments that sort of predominated the tweets related to the two conversations?
Yeah, so actually, it may be best to explain the sentiment analysis with that next table, because there's some examples of next. Let's see, I think table 1. Yeah, there we go. That one, table 2. So we had two sort of breakpoints in the analysis. We had a sentiment analysis and then a content or topic analysis, right? So the sentiment analysis essentially uses a pre-established lexicon that has a bunch of words in it, essentially like a dictionary, and those words are tied to a sentiment number, right, from extreme negative, -1, to extreme positive, +1 sentiment. And this dictionary has, to give you an example, something like -1, right, would be like hate. And then along that continuum, it would be dislike, then like, then love, right? So based off of the words that people are using, the tweet itself would be assigned a cumulative sentiment number. And then we take all of the different tweets that are in a particular topic or group, and we just give the mean sentiment. So for example, here, if you look at the very first tweet right here, it says, "Please, for the love of God," in all caps, establish an advance directive, blah, blah, blah. And that has that group had a pretty positive sentiment. Versus if you look at if you look at the discrimination category, it's sort of talking about old, disabled. We have likely prevented any few deaths. And so that has a negative sentiment. That, at least that group does. So we can go back to that first figure if we just want to compare the sentiment then for the advance. Yeah.
Sorry for really quick, Vishal. So just to, how do I say? So just to maybe put it this way, that this algorithm essentially is looking at a sentence and saying, this sounds broadly negative based on the composed words, on an average of the composed words, or it broadly sounds positive. And then you took the cumulative sentiment of each of these individual tweets to come up with this analysis. Is that fair?
Yes, that's exactly right. And so, as you said, since we're taking a cumulative of a lot of tweets, we're going to get a distribution. And so you really have to compare the subtle differences between a distribution when you have so much data. So if you look at advanced care planning, you see it's the median sentiment is it's pretty close to neutral, but you see that it's bimodal, right? So there's a huge peak in the positive area and a huge peak in the negative area. While for life support, it's fairly unimodal, right? The majority of the peak is in the positive, and so that's just saying that more conversations about advanced care planning had sort of two different sides to it, while those about life support were mostly skewed to the positive.
And I think that kind of lines up with anecdotal experiences that we have. Like I was telling Vishal yesterday, I would not post on Twitter, for example, my mom got put on ECMO and she still passed away or something like that, when you post publicly, you exhibit certain behaviors and you tend to want to, I think, often want to share positive experiences. And so for something like life-sustaining treatments, I think it's easier to say this amazing thing happened when my parent, loved one, friend was put on life support than the opposite. And I also think it lines up anecdotally that people have opinions about both life support and advanced care planning. They're not these purely cognitive discussions, they're personal. And so they feel like they should be bimodal in the way that people talk about them, either positively or negatively. And very interestingly, because most people have not had much exposure to life-sustaining treatments in terms of, I think, education, conversation, et cetera, the fact that it is perceived so positively, I think, again, that's something people bring into the hospital. I heard about a double lung transplant that saved someone from COVID. I want that. Or I heard about CPR saving my friend's mom's life. I want that. And so it's just, again, an important thing, I think, for me especially, and for many people to have in mind when we start these conversations, that this is kind of some of the information out there, and not good or bad. It's just, that's where we should meet people, is wherever they are in this process.
Right. Just because we think a certain way or we think we know a certain way doesn't mean that's where our patients are, right? And this is important to know. Actually, as I was looking at this earlier today, I was thinking about, I don't know if you guys know about this study where the authors went and reviewed footage from multiple medical TV shows, right? And they looked at outcomes from CPR. And, obviously the neurological recovery rates were outrageously high.
Yeah.
So to your point, then that comes with the same perception with life-saving intervention. Okay, so you had mentioned with analysis of the sentiment, you also analyze topics, right? So let's talk about what you found when you analyze topics.
Yeah, so actually, maybe the next, the next table would help, just defining all the topics or some of the interesting ones that we found. And again, this was done using machine learning. It essentially groups together tweets that have similar keywords and identifies the most, parsimonious set of tweets that belong to a particular group, right? So I think the one with the highest number of tweets was calls to establish advanced planning, the top one right there. And really, this one was just people tweeting out saying, "Hey, go make an advanced directive, right? Set your DNR status to, or decide on whatever your advanced care planning status is." So and that sort of makes sense as to why the sentiment was positive, because a lot of people were talking about this in a positive way. It's almost like a campaign type of thing. And actually, funny enough, that second topic, National Healthcare Decisions Month, was an official campaign that we found. So you may be familiar with that, but a lot of hospitals participate in either a National Healthcare Decisions Day or a week, and it's this organized campaign that happens every single April, and essentially the goal is to establish as many advanced care plans as possible, and sort of encourage that in those conversations in hospitals.
So other themes that were, obviously predominant or prominent, I should say, were, surrounding research, people's personal experiences with these topics, and then legal advice and discrimination. So I just wanted to delve into a little bit into these themes, because this is what conversations are about. They're going to educate what we think about these. So let's talk about the discrimination related tweets. So number one, I guess we'll go the same way. Do you know who the predominant users are? And broadly speaking, what was the sentiment that was associated with tweets that related to discrimination?
Yeah, Dr. Wallingford, do you want to maybe define that?
Yeah. So discrimination. So I'll answer your second question first. The predominant sentiment was negative, meaning it's pretty negatively perceived in the way that it's presented online. So meaning if I talk about discrimination, I did not talk about it in a favorable way, which is not unsurprising, I think, but it is by far of all of the sentiments the most negative as a group. What does that mean? I think that early in the pandemic, there was a lot of talk about resource scarcity, and with resource scarcity comes fear, especially if you're in a group where it feels like the resources would not be allocated to you. And so a lot of this discrimination, I think, is very important, and I think probably under-recognized in the way that we approach patients now, that perhaps by saying that we're going to have to create these algorithms and exclude certain groups, we have created distrust at a scale that we can't perceive really, but people come in with a little bit of fear or come in with a little bit of skepticism around things like, is the doctor offering me all the things that they have to help me, for example. And truly, I was a little surprised with how big of an impact this was in terms of the negative sentiment, because in my head, it felt like we were just trying to make ends meet with all the things that we had, and things were just going underwater. And also, I think the experience of people who are discriminated against is very strong. And because I was in the ER actually just kind of scrambling, I feel like the whole time, my focus just felt different. It was like, get it done, like see as many patients as you can, get everyone on the equipment that you have. And we actually never did run out of resources, and other places did. But all that to say, this negative sentiment around discrimination really should be a component of the way that we come into these conversations around end of life, I think, because it is an anchor from which people start to some degree. And then, keywords here. So disabled, old, those can connotate many different things, many different ages. What is disability? Vulnerable. But again, it's a sense that for many groups, we are labeling as having less access to resources if resources become scarce, and resources did. So we took all the tweets related to these types of things, and they were typically spoken about in a negative way.
And then on the other side, the flip side of it, some of the themes, the most sort of positive sentiment were related to themes where you were essentially sort of advocating for something. So for example, the National Healthcare Decisions Month, which has its own dedicated hashtag year by year, right? Similarly calls to establish your advanced care planning, like Vishal was mentioning. That makes sense. What about things that had like more of a neutral sentiment to it? Research. That was interesting to me, right? Because I thought it would lean one way or the other, right? Or is it because, not to become political on a academic journal club, but does that show us how divergent we were about how we felt about the information coming out, or what did you learn from the keywords?
It seems to me that when people talk about research, they're probably not inserting as much emotion and interpretation into the way that they talk about it, which again, I think is a really important lesson that we take away from the pandemic. It sounds very different to a layperson to hear that there's no evidence that masks work to reduce the spread of COVID-19. which in science parlance, as many people know, actually just means that we don't have enough research to say for certain. It doesn't mean that it doesn't. So, but if I told my mom there's no evidence to suggest masks work, she would hear masks don't work. And so I think the point I'm making is that if we use really, really neutral language all the time around research, it may not actually have the impact that we hope it does. We hope that we do research so that people change behaviors. We do research so that people have better outcomes. But if we talk so neutrally about it, perhaps we're not reaching the emotion center of people that engages them in, oh, cool, there's this new finding and there's a new thing.
But wait.
Yeah.
Is that but wait, right? Is that there's this new cool finding, but wait. And then you don't basically, I think it's the same with legal advice.
It's a balance because like this new study on communication tool for engaging patients, it's so neutral. Instead of saying like cool new communication tool improves communication or something like that, you know?
Yeah.
But we're trained to be neutral, and I think that's good in many cases. It's just how you use it. But that's my hypothesis on why research is so central here on the way that it's talked about.
And just to hone in a little bit more, and if you don't have this information on hand, I get it. But for each of these major topics, do you know which user groups tended to be the most heavy users for each of the topics?
Yeah, I don't have it off the top of my head, but if you go to table, I think, let's see, it's up here. That one right there, yeah. So here what we did is we grouped the major user types on the X, and then on the Y we have the same topics. And so if we go to the interesting ones, I guess. So we can start with we can start with calls for action, really. And so first, maybe we can look at the tweets before we look at the retweets. And it looks like let me also define here that little subscript A. There's no footnote, but the subscript A means that that particular user type talked about that topic significantly more than was expected. While the B means it was significantly less than expected. Okay. And then without a footnote, there's no difference really. So organizations tended to talk about calls for action more than other users. Maybe this goes in hand with the National Healthcare Decisions Month, right? That one also had an A there because it's really a campaign, and organizations may be initiating and spreading the messaging around that campaign. Then if you look at, for example, if you look at personal experiences, organizations didn't really mention personal experiences. That kind of makes sense. Influencers didn't really. Of course, individuals did, and even clinicians did, right? These are the people that we're talking about personal experiences because they are likely the individuals that experience them, right? And then the next one, I think discrimination is important to talk about. It looks like everybody except for individuals, right? Individuals are the ones that talked about discrimination more than anyone else. So while organizations maybe retweeted things about discrimination and clinicians may have retweeted things about discrimination, they weren't likely to make a unique post about them. And maybe this just, again, points to the fact that we aren't, clinicians aren't really trained to talk about discrimination about advanced care planning. But individuals may be the ones that are experiencing these sentiments or just having these thoughts, and that's why they're likely to talk about it.
So I think that's a pretty good summary. As we start heading towards the sort of closes journal club, I think what I would love our readers to do is look at this table and think about the different facets, right? So for example, I'll just highlight, for example, the discrimination part of it. So who talks uniquely most about discrimination here? As is evident, sounds like it's individuals. So I'm assuming it's either affected people, affected practitioners, right? But then who amplifies, I'm just going to use amplifies for retweets, is organizations are willing to amplify, and so are clinicians. So what I couldn't parse out here is it is it these entities not being willing to engage in this nuanced conversation? Because Twitter is not exactly easy to have their conversation on within constraint of characters. Or is it willingness and unwillingness sort of question? Or is it them just listening and saying, okay, we see you, let us do what we can to help you sort of spread your word out, right? Because you also see these the influencers not engaging in either of that, where the influencers seem to be primarily out there talking about research or promoting stuff about precautions, right? So I don't know if it's them giving space, is it not being able to engage? So I think clearly you guys have also, in doing this, identified that we have to understand these sort of nitty-gritties of this going forward, right?
Yeah, totally. And I think, a big part of that is it is part of one of our conclusions, although influencers do have the potential power to do so, right? To spread this important information. They really didn't spread information about discrimination. And one thing I didn't bring up, but the very far right of this table, you have the retweet to tweet ratio, RT:T. And that has been used in other studies as a potential marker for engagement, right? For every one tweet made, how many are actually reposted? And the topic with the most, the highest ratio is personal experiences. So that shows that people are really connecting to these personal experiences. And then discrimination is second, or I think it's second. Yeah, it's tied with, no, yeah, it is. It's tied with research actually. So for second, I would say. Yeah, Dr. Wallingford, we're going to say something.
I was just going to say that personal experiences, I think, in some ways are powerful because they're story. The other stuff is concept or a mix, probably. And so, framing things as stories clearly has an influence, it seems, in the way that people want to share them. And I think that runs in some ways counter to our tendency in medicine to try to keep things as scientific and neutral as possible, like I said, but then it also has an impact in how widely it gets spread. So if we could frame, here's some research and here's a story related to it, like, hey, there's this new drug, and for the first time in my career, we've been able to save this patient, and here's a picture, for example, that might be better than, drug A is significantly superior to drug B. And so it could also alter the way that we try to share information if we're doing it on a platform where there's something to retweet. And discrimination, my guess too, is more story in a way that people may talk about it conceptually, but also in the way that it affected them or the way it affected their family. And so perhaps is a reason why it got shared more. And I wonder too with research is just because researchers are experts in something, people don't want to try to summarize the research. So it's easier to hit retweet because it's like already written by an expert, and coming from that expert as a retweet seems more impactful than if I just say something not from the mouth of the researcher who produced that insight.
Interesting. All right. So to summarize where we have come so far, we took conversations off of Twitter, tweets, to see which ones pertain to life-saving interventions and advanced care planning. So try to understand who are the users having those conversations, and we broadly understand that there was more conversations in relationship to life-saving interventions than advanced care planning. And then broadly, the sentiment was more positive as it pertained to life-saving interventions. And then we briefly discussed the themes and sort of who engaged with these themes and what we can potentially make out of these. So all helpful information. In all of this, what did you guys identify as the shortcomings in either the methodology or how much we can push the interpretation?
Yeah, so this is a pretty non-traditional study, I would say. And so there are definitely shortcomings to the methods here. So, using Twitter as a source for all this data, while we had a lot of tweets, it's not completely generalizable because not everybody uses Twitter. Even of the users that have Twitter accounts, not everybody actively tweets, and then not everybody is going to be vocal enough to tweet about some sensitive topic. So we may not catch those people. And then, a systemic sort of limitation is that we only analyze English tweets. There are people in other countries that don't speak English and don't tweet in English, so we didn't catch those. And there are also other countries with limited resources that may not have as much access to internet or Twitter, I guess. And we probably didn't catch as many of those people in those third world countries. And we were actually talking about this. Those individuals may be the ones that we're actually trying to reach or trying to educate about advanced care planning the most. And we aren't really able to sort of detect how they talk about these things.
Yeah, I think that was interesting, the low and middle income countries, right? There was not as much conversations about advanced care planning. And is it because that's just not a topic that's generally broached upon versus it's talked about in a different manner? It's hard to parse that out, I would say.
Yeah, I agree with that.
Okay, so we take all of this, all the information that you've shared with us, understanding the sort of caveats, which, every study has. So if now our listeners who are researchers, clinicians, they have to take anything from this, what should that be?
So one thing that I took from this is that influencers have a disproportionate share of voice on Twitter, which I think we kind of know generally. But it is interesting that even in advanced care planning and life-sustaining treatments, which are niche topics for many, I think, of our influencers, they also have a disproportionate share of voice. And so I wonder how we can engage influencers in creating content or partnership to really improve how this conversation happens at a bigger scale. Because when we try to reach through clinicians, individuals, and organizations, you can see that like their collective bars were almost like invisible compared to the bar that showed the number of eyeballs that influencers hit. And so I think for future pandemics, but also for important movements in general, I think it's just important for the scientific community to acknowledge that perhaps influencers would be helpful partners when thoughtfully partnered with. And I think the second piece that I take away from this is, again, meeting people where they are in their own conversations. Just asking, what have you heard about advanced care planning? Did you ever talk about discrimination? Opening that door just a little bit to acknowledge and open the space for people to talk about, yeah, I did. I was very worried because my mom is in X group or whatever, can help build trust, meet people where they are, and help with this process of really talking about how people want their values to really meet their medical care that they receive. So there's, I think, like a larger movement type thing. And then like, what am I going to do today? I might ask one more question that I wouldn't have before we did this.
I agree. And I think just there's so much data and so much conversations that are happening there. And they can help us understand priorities. I think that is huge. So I appreciate all the work that you guys have done, both Vishal and Dr. Wallingford, and your willingness to take time and share with us. I agree it's a non-traditional study, but with the sort of increasing uptake of social media and engagement by actually all stakeholders during the pandemic, as other studies have showed, I think it's super important that we do sort of listen to these and try to, sort of inform our practice or our bedside approach here. So I appreciate it. And thank you so much. And if you guys have any questions out of the listeners, feel free to reach out. I'm sure Vishal and Dr. Wallingford would be more than happy to expound more on this. And all the best. Continue doing your good work, guys, and take care.
Thank you so much. Appreciate you having us.
Thank you.
Thank you so much.
Yeah.
Bye.